Respiratory distress syndrome, RDS, type 1, dyspnea shortly after birth, usually within 6 hours, is called respiratory distress syndrome or RDS. And it is due to surfactant deficiency. Surfactant is a substance which keeps the pulmonary alveoli in dilated state. In its absence, alveoli get collapsed. It is more common in the preterm, low birth weight, infant of diabetic mother, and asphyxiated baby. This child has typically more respiratory rate, they beat faster, they have expiratory noises called grunting, they have recessions, subcostal, suprasternal, intercostal, and your and the your subcostal recession. May have cyanosis. It appears to be pneumonia in differential diagnosis, congenital pneumonia, diaphragmatic hernia. But an X-ray is your confirmatory of typical reticulogranular pattern, mottling, and bilateral disease in late stages. Pneumonic fever, cough, and then they are absent in these cases, but at times the confluent opacities, air bronchogram pattern, a little bit of confusing with pneumonia. So, how to treat these children? They are to be monitored in the neonatal intensive care unit. They need oxygen inhalation. They need IV channel. They might need your continuous ambulatory, continuous CPAP and oxygen. When this desaturation, hypercarbia, and acidosis, they are the indications of mechanical ventilation. Surfactant therapy, intratracheal surfactant 4 ml per kg is the standard way of treating these cases. Antenatal IV dexamethasone, 1 to 2 doses, up to 4 doses can be useful. If you give it to the mother, the baby may not have it. 6 milligram per kg or total dose. Complications of this RDS as infection, bronchopulmonary dysplasia, pneumothorax, intraventricular hemorrhage, retinopathy of prematurity. Prognosis is good, they have good survival. At times, transient tachypnea of newborn, called RDS type 2, can be confused with this RDS respiratory distress syndrome, so-called type 1. And this transient tachypnea or type 2 variety of RDS is due to your inability or inadequate absorption of the pulmonary fluid, more commonly the male, boys, and the neonate. Lower uterine cesarean section is important cause. And macrosomia, the baby with large baby, more than 4 kilo, has more commonly it, and delayed cord clamping 2 to 3 hours after birth. They have they have little bit of tachypnea and they persist for 24 hours. Usually they recover, this sort of tachypnea, they recover without any treatment 72 hours. So up to 72 hours, keep vigilant eye of treating this RDS type 1, the grave one, and then and the pneumonia, another grave illness. So ultimately transient tachypnea of newborn is, as I said earlier, recovery takes place by 3 days or so. They have the flat diaphragm, they may have hyperinflation, may have fluid in the pulmonary fissures. They are to be treated conservatively and the prognosis is good.